Mike, I dislocated my kneecap. What should I do now?
A dislocated patella is a really uncomfortable and awkward injury to get. Basically what happens is and more typically, is when your patella slides out of the groove and goes to the lateral side. So if you dislocate your patella, the way that you want to get that to go back is to straighten out the knee. That will reduce the patella back into the groove and give you almost instant relief. Now, what generally happens after you've dislocated your patella once is these medial ligaments that control or support the kneecap in the groove are now torn. So it's more likely that you would be at risk to re-dislocate that patella. Now, there are surgical procedures to reconstruct that, but again, I really like to look above and below. In addition to strengthening the quad and the local tissue around the knee, we have to look at the environment or conditions that knee operates in. If you have really poor hip mobility and you sit in a bit of femoral torque or internal rotation, it's more likely that you might slide that patella off the lateral condyle, and then even some genetic factors like a shallower lateral condyle might predispose you to a patella dislocation. It is an awkward injury. There are surgical interventions for that, but I've also had a lot of success really just doing a great rehabilitation and building a lot of strength and stability around that knee while addressing the joints above and below, and a lot of athletes can return without needing surgery at all.